Good evening and welcome to the Monday, May 11th, Maplewood City Council Manager Workshop. City Clerk Sint, would you do the roll call for us?
Councilmember Cave.
Here.
Councilmember Juniman.
Here.
Councilmember Lee.
Present.
Councilmember Villavicencio.
Here.
Mayor Abrams.
I'm here as well. Thank you very much. Council members, is there a motion for our agenda?
So moved.
Second.
Moved by Cave, seconded by Lee, the motion to approve our agenda. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? That motion carries. We have no unfinished business tonight. We have a presentation from Chief Mondor, the state of EMS. Chief Mondor, thank you for coming tonight.
No, it's not working.
Little technical difficulties.
That's all right. Backup number 2.
That's better? Okay. Mayor and Council, thank you for having us this evening. In late 2024, I provided a state of EMS update that highlighted more of the financial concerns around reimbursement in EMS. And we wanted to come back and kind of highlight the positive things that are happening in both fire and EMS, but with a focus on EMS. So if I could have the slide deck, please. So this evening, we'll talk about, we'll do a review of EMS demand, calls for service in the community, highlight our history of innovation and research in the fire and EMS departments, talk about our community problem-solving efforts, some of the investments in the future of EMS and where we're heading from an EMS perspective. Run volume trends, year over year. We experienced about a 3% increase year over year, and that's been very consistent going back to 2016 even. So over the past 5 years, we've experienced about a 15% increase, just over 3% each year. Last year, responding to just under 8,400 calls. As you're aware, each quarter we report on our travel time as part of our response time metrics. Back in 2017, City Council adopted an 8-minute travel time. That's one element of the entire response time, but also the most reliable for planning purposes. And that informed our investments in new fire station location and then consolidation of fire station, and also helped inform staffing decisions. As you can see, in 2021 and 22 post-COVID, we were not consistently meeting that mark. And in 2022, I came to council and presented a long-range staffing plan, which you all supported, and we've been implementing in a stepwise fashion year over year until we got the SAFER grant, obviously, in 2025. And so when you get down to the low 80s, that's obviously concerning that we're not meeting that travel time perspective. You can see the first arrow there is when we opened the new North Fire Station and put our resources in areas that are going to best meet that travel time performance standard. And then in Q1 2023 was the start of investing in the long-term staffing strategies. And you can see following the fire station and following the investment in staffing, you can see that line start to go up above the 90th percentile, and we've lived there since Q4 of 2023. And this is despite continuing increases in call volume year over year. So these investments, this graph highlights how the investments are making impacts in the community and our ability to respond in a reliable fashion. EMS call volume represents 82% of our overall call volume year over year. Similar graph, similar trajectory. Obviously, when one part of the response, EMS, represents such a large portion of your calls, that's going to drive your year-over-year growth in relation to calls. In 2025, we did just under 7,000 EMS calls out of the 8,400 total calls. Mutual aid analysis, in 2022, kind of post-COVID, we started to see a trend where the mutual aid utilization was no longer mutual. It started to tick up in 21 and then 22 and 23. It was, I would say, is just out of control. The mismatch in amount of resources leaving the city of Maplewood versus coming back into the city of Maplewood. We have strong relationships in the EMS community. We leverage those relationships and had conversations with stakeholders. With Mayor Abrams has been involved in those, City Manager Sable, and said, you know, we need to make sure that the investments that are going into Maplewood are available in Maplewood. We're always happy to help our neighbors, and we need help from our neighbors, but we need to have some balance in the mutual aid. Following, you know, a couple of years of consistent pressure, we started to see that come back down in 2025, very much more balanced, where we were at 276 resources leaving the city versus 197 received. That level of variance is very acceptable given year-over-year differences. And in this year, it's even closer to given and received so far, even though we're early into the year. So just a lot of efforts by staff to make sure that the investments aren't just taken advantage of and that we're making sure that our residents are taken care of first, knowing that the relationships with our partners also is extremely important. We rely on each other each day. Just right now, we're at an incident where we have 4 other communities helping us in the city of Maplewood, and that happens almost daily.
Chief, I have to say, I really appreciate your approach on that partnerships are critical. But when you took a look at what happened that one year, there was that imbalance. So thank you for recognizing that and paying attention to it.
Yeah, and I think I appreciate that, Mayor Abrams, and it highlights the department's embrace of data and data analytics, and I'll talk about that a little bit later. So we can recognize these things. We don't wait till the end of a year to look at this. Like, we're looking at these trends daily, weekly, monthly, quarterly. But it does take time. We're not going to just abandon partners. We want to work together to make sure all of our communities are safe, and through time and kind of some relentless pressure, we're able to make it more normalized here. Specifically to EMS, I just want to highlight, kind of a long journey that Maplewood EMS has had related to pre-hospital care. So emergency care that's delivered outside of the hospital. In 2013, we were the first EMS agency in the state of Minnesota to adopt a system called HandTevi. It's a pediatric pre-hospital care bundle that's designed to improve pediatric emergency care in high-stress situations. So luckily, a very small percentage of EMS's call volume is related to children or toddlers, infants. When that happens, especially when they're very sick, it can be extremely stressful for our staff and obviously for parents and everyone involved. And so this platform provides medication dosing guidance for both pediatric and adult patients, standardized equipment. So for anyone pretty much in this room, if they have a medical emergency, there's a very small set of sizes of equipment that we can pull out of one bag. Well, when you're talking from a premature infant to a 6-year-old, 8-year-old, 12-year-old, that equipment can vary dramatically. Back in 2013, we have ready-to-go equipment. If we go to a 12-year-old, they pull out that. They have dosing guidance. They have best practices that are right on their fingertips to be able to take care of the patient, and also training to back that up so that we reduce the stress. And it was one of really the best innovations in my career to help improve patient care in EMS. Around that same time frame in 2013, we implemented video laryngoscopy, which is essentially how we put breathing tubes in. So instead of, when I was trained, you had to look directly into someone's mouth to try to put in that breathing tube, we have video capabilities so that you can see a broadened view. You can record that for quality assurance and quality improvement purposes, and dramatically improves innovation success rates. We've been part of a lot of industry-leading research, primarily around the leading cause of EMS-related incidents in the city of Maplewood, which is falls. So back in 2015, we worked with Regions EMS and orthopedic surgeon to review retrospective, looking back at falls data to identify the prevalence of falls in the city of Maplewood and helped validate it as a significant health risk in the community. Second study that we just recently completed was with the same orthopedic surgeon who also now works for Ohio State University, focusing on identifying methods to better predict the risk of fall, and then how virtual options post-fall can help improve interventions and help residents stay safely in their homes. Right now, an ongoing study with Regions Hospital Injury and Illness Prevention, we're piloting a program with our community paramedics that will follow up on all non-transport fall calls. We started at an isolated assisted living facility that had high incidence of falls. We've now broadened that study beyond those walls to try to figure out different strategies we can implement with our proactive resources through our community paramedics to prevent falls, and not just saying, hey, if we know falls are a problem, we're just going to ignore it and keep responding in traditional methods. Also, just investments in employee wellness on several different fronts. We were one of the first agencies in the state of Minnesota to implement a power load system, which helps getting patients in and out of the hospital, reducing back injuries and stresses on elbows and knees and shoulders for our staff. Community problem solving. We're one of the few fire departments in the state of Minnesota to have a community paramedicine program where we focus on people with chronic healthcare conditions and try to send resources out proactively beyond falls and help people manage the healthcare system before they call 911. We do follow-up prevention care, focus on meeting residents where they're at. We have a great community paramedic team, 2 of them, which are pictured up there. I also do fall risk assessments, prevention strategies, care plans, and coordination, and work hand in hand with getting people connected to the appropriate healthcare institutions. So oftentimes people, when they're not used to navigating the healthcare system, their default is 911. We're always here to respond. We don't determine what someone's emergency is. But when we identify that they're using 911 at a high rate, we can help them through these proactive measures to be like, hey, it would be helpful for you to manage your healthcare condition if you did a regular appointment with your physician. Can I help you do that and manage that? And when you talk about people that aren't used to navigating those systems, that intervention helps them better advocate for themselves and navigate to the appropriate levels of care, which in turn we're aiming to reduce the 911 utilization. Our mental health outreach team, obviously a team of community paramedics, Maplewood Police Department staff, and embedded social workers focused on supporting individuals with mental health related needs in the community. I got to give a lot of credit to where it's at today, and our current embedded social worker does a lot of the heavy lifting there, but there's still a lot of coordination between police, our community paramedics, and the embedded social worker. Also have our fire marshals assigned to unsheltered outreach in the community. That's another way that the fire department's unique. There's not a lot of fire departments that are putting resources into working with the unsheltered community in tandem with our embedded social worker. Our fire marshal works to support the health, safety, and housing needs of unsheltered individuals. We don't just respond to concerns. They have a weekly meeting Monday morning where they go and visit known spots where there's activity to try to support people, try to connect them with housing, and they round the city regularly with the goal of balancing individual needs while also understanding that there's a sense of safety and livability for all residents in the city of Maplewood. So we're trying to be supportive, and I think we've done we presented at the Ramsey County Local League of Governments, and I feel like we've set a model that best supports our community. Current, post-COVID, again, there was several impacts to fleet procurement, several delays to our ambulances, and we were having a lot of challenges with the current fleet, given the amount of maintenance needs when those vehicles are aging. We've invested in those and now have a modernized fleet, and we'll plan to continue that. We've made improvements in how we track our controlled substances to align with DEA requirements. And as I kind of alluded to earlier, data-informed decision-making. So we have an advanced data analytics tool that takes all of our different records management systems, and we have dashboards that our battalion chiefs and chief officers and captains can look at daily to identify trends, to identify, hey, this address has had a lot of utilization. We should send a community paramedic out there. Or this place has had a lot of false alarms. We need to send the fire marshal out there to do some in-person outreach. Also helps us ensure that we're making sure that we're sending the right amount of resources at the right time for the right reason. So we've recently, now we have a staffed engine at the north and south fire stations. In some communities, they just send the fire engine to every call. We use data analytics to inform how we're going to use that resource because it's a valuable resource. We're not just going to arbitrarily send it to any call type in the community because there is a lot of a demand, and we want to make sure there's resources available. An example of that coming to work is for us, we learned that a stroke call, and we can run through this metric, what kind of call results in a lights and siren transport to the hospital. So we would not have normally sent an engine to that call type given the code. We looked at the data and said 30% of the time if they go to this call type, it results in an emergent transport to the hospital. So using data analytics, we now send a fire engine to that call because we know that there's a 30% plus likelihood that it's going to require more resources rather than them having to wait there and be like, this is a problem, now send help. Also investing in employee development. Our fire EMS cadet program has been a tremendous success. We just onboarded 2 new cadets to full-time status. 8 of the 10 people that have gone through that program are employed as full-time firefighters. Not all in the city of Maplewood because we didn't always have vacancies or in the full-time ranks, but we're tremendously proud of that program and what it's led as a pipeline to feed the future of fire and EMS. And then up there also is a picture of 3 of our current paramedic students, so developing existing staff, sending them through paramedic school so they have advanced training to continue to care for our community. As I mentioned, in 2022, I presented a staffing implementation plan. This is where we'll be at by the end of this year with minimum staffing levels. So you saw earlier that 90th percentile dropping down into the 80s. With these investments, we've added 2 additional resources to be able to respond to emergencies in the community, the South Fire Engine and Battalion Chief. And we've also ensured operational readiness on the fire side by ensuring that we have a minimum of 3 people on those staffed fire resources each day. A big part of this was the SAFER grant that we were awarded last fall, but the city's continued investment in staffing is much appreciated and has allowed us to meet our travel time standards. So I did bring a guest today. Dr. Haley Taramina is our medical director. She's been our medical director for the past couple of years and has really just embraced the Maplewood Fire Department's culture about wanting to be leaders, wanting to be problem solvers and innovators. And it's helped us continue to keep the momentum. So that's why I gave you kind of the history of where we've been, because I'm really excited about where we're at today and what the future looks like. And one of the most exciting pieces of that is whole blood implementation. So in April of this year, after about a year of planning, there's whole blood in our battalion chief vehicles that can respond to the emergency scene. So that's unique. There's 3
different services total.
3
in the state.
In the state of Minnesota, 3 agencies that are carrying blood. And we happen to be one of them. All roads from the east and a lot from the south go through Maplewood if you want to get to the trauma center. So for people experiencing trauma, they have to pretty much come through Maplewood, and we're now a regional resource with blood. And I'm going to let Dr. Taramina talk a little bit about the clinical impacts of what that means for the residents if you need blood.
Thank you very much, Chief. Mayor, council members, thank you so much for having me here today. Like Chief Mondor said, I've been the medical director with Maplewood for several years now, and it's been a joy to be able to work with a department that's so innovative, makes my job fun, makes my job easy. And this was one of the most fun things I've been able to do as a medical director, is help implement whole blood to the streets of Maplewood and also support the surrounding communities. I just need to emphasize how rare this is to have. We are truly one of the premier services throughout the nation, not only just in the state of Minnesota, to be able to have this resource, and we are right on the cutting edge with this. So this is something to be proud of, definitely. We know that blood is important, right? So if somebody gets into a car crash and they're bleeding out, what we need to do to stabilize them is to give them blood back, all right? So typically in the field, all we had was saline, which would really just wash people's red blood cells right out. There was a 2% increase in mortality for every 1 minute it took from the time of injury to getting blood. And that can take a long time if somebody is trapped in a car. And we don't necessarily have blood that's available within seconds on arrival to the emergency department either. It takes some time to get access to that blood. So being able to bring blood to the streets, to the scene, hook it up, give it to somebody who's still being taken out of a car that's crumpled, is improving mortality significantly for the city of Maplewood, but also for our surrounding partners. This is really a regional asset that we're very, very excited about. So this is going to save lives. We haven't had any cases yet. Trauma season is approaching, and I know that we will, and this is going to be a very, very big deal. So we're really excited about this. All right, a couple of other things that I can nerd out about to you guys. The first one being ultrasound. So we actually have our crews trained in pre-hospital ultrasound. So they have little iPads or even their phones that they can connect to an ultrasound probe to be able to get real-time information on scene for patients. That could be anything from looking at the heart for somebody that's in cardiac arrest. That helps us guide the next steps. We are going to be implementing looking at the belly as well to see if there's blood in the belly with crashes, which can help us determine if the person needs the blood that we're bringing to scene, and to ensure that that person is going to a trauma center rather than to one of our smaller hospitals, a center that can handle that kind of an injury. So being able to have our providers trained in ultrasound is, once again, kind of a next level skill. We are one of the leaders in the country with this, and it wouldn't have been possible without the support of the city of Maplewood, as well as the support of Chief and crews that are very excited to be able to learn these new skills. ECMO is something that I don't know if you guys are very familiar with. There's been rumblings around the Twin Cities. So what ECMO is essentially a way for us to replace the heart and lungs of a patient. This is a very novel technology. We are one of the best places to have a cardiac arrest in the entire world right now in the Twin Cities area. So yeah, take that in. That is just insane. If you're gonna have a cardiac arrest, you are in the best place in the entire world to be able to have that right now. So essentially what we can do with ECMO is if somebody goes into a specific kind of cardiac arrest where their heart is quivering and it's just not pumping blood throughout the body, we can put them on a machine that pumps blood through the body for them and also provides oxygen to the body like what the lungs typically do. So it replaces the heart and the lungs, okay? And in order for this to be successful, we have to get patients taken to the hospital as quickly as possible. And that's only possible with our crews being exceptional on scene, being able to recognize the kind of cardiac arrest that person is in, provide stabilizing care, and loading and going and activating our pre-hospital ECMO teams as fast as possible, which has been great. Next thing that I really want to highlight as far as what makes Maplewood special and unique is their emphasis on internal QA and QI. They take very seriously every single call that they go on, and they're making sure that they're monitoring and looking for ways we can improve patient care moving forward. So Maplewood is unique in that they have their own internal system, and then me as a medical director through regions, we have a system that then reviews what they have already reviewed. So it's a great system, and it works really well to make sure we're providing good care. Community partnerships is something that Maplewood has been exceptional with as well. Every year, the region's residents go to the East Metro Training Facility, and Maplewood hosts a resident EMS day where our emergency medicine residents get to see what it's like to be in the field. They get to deal with live burns, they get to help take patients out of crumpled up cars, and it's really a way for them to appreciate what our pre-hospital providers are doing. And Maplewood has done this year after year, and it's a great way to get back to the community. All right, and a couple of other highlights. There's so much we could talk about, but we're trying to be respectful of everybody's time here. Suboxone has also been a new innovation that has come up within the pre-hospital field lately. And this is a medication that is really, really important for people with opioid addiction. So it can help them get through withdrawal, but it also significantly reduces the chance of them going back to using again, which is a really big deal. What we've done in Maplewood is now we can give patients their first dose of Suboxone on the streets, and that's huge because a lot of the times patients don't want to go to the hospital and then they don't have access to that medication, which could potentially stop that addiction. So our medics are doing that in the street right now, which is really important. And then similarly, leave behind Narcan kits. Narcan is widely available now, but we make sure that our overdose patients are getting those kits in case they don't want to go to the hospital, so that way they still have that resource available to keep them safe at home.
Councilmember Cave has a question.
Hi, just one
Yeah.
quick question on that Suboxone. How many doses does somebody need to have it start working and possibly not have them want to take a drug again?
Yeah, so that's a great question. So in that immediate phase, when somebody is in withdrawal, one dose can make them feel almost immediately better. And that's really the window that we want to capitalize on, right? When we can show people, look, you don't have to feel like this. Like, you don't have to feel miserable. You don't have to be vomiting. Like, we can give you something that can help prevent you from feeling like this in the future. Now, that is a medication that people need to maintain to be able to keep that addiction kind of tampered down, but it works immediately for withdrawal, which is great.
Thank you.
Talking a little bit further about what's coming up next, pre-hospital antibiotics. Regions currently has the only service in the entire state that is giving antibiotics in the field, and that's something that we're working through with Maplewood in the future, specifically for open fractures. In the hospital, we have to give antibiotics within 60 minutes of injury. And as you can imagine, if somebody is crumpled up in a car and it takes them 45 minutes to get them out, we're going to miss that metric. And that's really important to reduce infections for people that have got bones sticking out of their legs. So being able to, once again, start the care immediately on the street, not waiting until we get to the hospital, is really important. IV Tylenol, we've also implemented just as an alternative to opioids for our patients that are really hesitant to be able to receive opioids for pain in the emergent setting. And then, like I talked about before, we're moving forward with ultrasound at a pretty rapid pace to look at the belly, and we've got an active research study going on right now to essentially be able to look at the vessels in the belly with ultrasound and make sure that our firefighters are hydrated on scene, which is really important as well. So those are some next steps coming forward with the city of Maplewood. Any questions for us?
I have a question concerning reimbursement. What we are doing is obviously very cutting edge. What does that look like in terms of the reimbursement, world? Because, we're fire EMS, and then it gets transferred over to the healthcare folks. How does that work in terms of some of the new things that we're doing?
Unfortunately, some of the things that we're doing are not going to be directly reimbursed because of the way that the fee structures work. When you talk about whole blood, we're not actually paying per se for whole blood. That's billed through the hospital. So they're giving us the blood to use, and then they bill the patient. Because if the EMS department billed it, we have 3 levels of care, basically: a BLS, which is basic life support, advanced life support 1, and advanced life support 2, which is like those cardiac arrests need blood. So we'll be able to bill it at that higher rate, but we don't have line item billing for each intervention or medication that we provide. That's something we're advocating for at the both state and federal level. We've talked a lot about just the overall lack of Medicare, Medicaid reimbursement as compared to costs. But so not a direct increase in reimbursement per se, but we had a grant to get the infrastructure for the blood, and then the cost, essentially, the hospital bills that as part of the patient's bill when they're at the hospital.
Thanks. Anyone else have any questions? Councilmember Lee.
Thank you, Mayor.
I appreciate the presentation. I mean, you guys have always been pretty awesome, but after tonight's presentation, you guys are even cooler. So, well, thank you for that, though. So looking at this, I think staying on the leading edge, I think that's a great way to put this. It's great that we're utilizing what's available out there to provide the best services that we can to our constituents. And I mean, that's really the whole purpose of our investment into the fire department. So the pre-hospital antibiotics, IV Tylenol, enhanced ultrasound. I mean, in terms of a timeline for when some of these possibly can be used here in Maplewood, what does that look like? And I mean, I'm not going to hold you to any numbers, but in terms of investment, what does that look like for our council going to the future?
Councilmember Lee, thank you. As far as timeline, sorry, Joe. As far as timeline, the big project was to get blood moving, so we spent a lot of time and effort just focused on that, given the amount of moving parts to get that off the ground. As far in cost, all those initiatives that were listed are really the negligible costs that we would absorb into our existing operating budget. So we're not going to be giving a lot of them, and they're very inexpensive, those investments, or the future ones right now. So shouldn't see a major increase in any asks. We've calculated to be able to do that in our existing budget. And sometimes we take treatments or medications that maybe were clinically relevant 5-7 years ago, and we put those on the shelf that's how we've adjusted to be like, hey, we're going to invest in antibiotics and Tylenol now because that's what the research states. And maybe this medication that we had historically used isn't known to be as effective, so we're going to swap those procedures out.
Thank you.
Councilor Cade.
I just want to thank you for all you've done, and you also, medical director. This is above and beyond, I believe, myself, what our citizens have even asked for, and to continue this type of service is just exactly what our taxpayers have asked for, but they don't even know what great things are coming to them. And you guys are just, it's really impressing me, all the things that are out there, and being such an innovative person, Mike, it's just, and bringing all this is just so fabulous to Maplewood. You can't go anywhere. Just keep bringing this stuff here. So thank you so much.
This might be something good to put into the Maplewood Living, because you're right, I don't know that our residents realize the level of care that that they can come to expect here in Maplewood. And I think that with our partnerships with other cities, I think that it's something that this is ultimately going to help a lot of people. But I think we need to put something out there in the Maplewood Living so that people really know that. And I see that our communications director just is out in the hallway. Okay, we got a note on that.
We are working on the whole blood rollout as part of,
Okay.
I have to check with Joe on schedule, but yeah, we have talked about making sure that we're highlighting these where people can access them.
And some of these other features too that you're doing, I think that it's critical that people really know. There's a certain comfort factor to that you're there when we need you, and it's not just the way people, I think, envision the type of care that you get locally. So, thank you. Very important. Councilmember Villavicencio.
Thank you, Mayor. And thank you, both of you, for your leadership. And, it takes strong leaders like yourselves to, bring these strong initiatives to make Maplewood better for all of us. And, I heard a fire truck the other night, and it reminded me of living by the North Fire Station and hearing it every day. And people would ask me, well, how do you feel about living by the fire station? And I said, I don't mind it at all. It was a reminder to me all the time that you guys were taking care of the city. So thank you for that.
Thank you.
Councilmember Cave. Okay. We have no other questions, but thank you very much for the presentation. We really appreciate it.
Thank you.
And now, council members, you thought we were done with the budget.
The exciting part of the evening.
We are ready to start again, to start anew. Mr. Rube, you are going to do the initial 2027 budget kickoff.
Good evening, and thank you, Mayor and Council. I hope you're ready for a very exciting, awesome presentation on budgets.
We are.
May I get the slide deck, please? Can you not hear me? Oh,
It's coming.
cool. All right, thank you. Here's a high-level overview of the budget process. I won't go through each one of these right now. I'll go touch each one during the presentation. New for 2027 budget process, staff added a special meeting with council to review past trends and then set council priorities. That meeting will be on June 15th, and you'll see that in our budget calendar later on. However, if council has any priorities that they'd like to share with staff tonight, we'd be happy to take them and keep those in consideration as we move forward with the budget process. The key stakeholders continue to be residents, businesses, council, and staff. Our priority as staff is to continue to provide the highest level of service that we can to our residents and businesses. For the EDA budget, the levy for the EDA will remain the same as last year. There'll be no change in that, so there won't be any impact to the residents, which is great. You may see some changes with the overall revenues when it comes to grants and aids, and then some changes with the expenditures that we plan for the EDA budget as we look at projects to 2027. Staff will continue to rely on our financial management plans that we have set in place as we build the 2027 budget, as well as the 2027 to 2031 capital improvement plan. And although we don't provide the ECMO and ultrasound services, we do provide budget engagement with our residents. So new for 2027, we handed out at the spring cleanup event this flyer. On one side it had the events, and the other side it has our some budget information. You'll notice on the right-hand side it has the schedule of budget events that are taking place and what residents and businesses can expect for the budget process this year. With the Maplewood Living, this is the image from last year, so we don't have an article yet to go out, but it'll be something very similar to this. And then we're providing this to make sure that the residents are informed at all points, and then if there's any new updates that we can provide, we will include it in the Maplewood Living. This is a screenshot of the budget webpage for 2027. On the right side, again, providing the list of dates when it comes to the budget process, just to make sure everybody's informed. They can find it in multiple different locations. And then on the left-hand side, on the top side, is a purple icon that will bring residents to a budget survey. We want to make sure that we get feedback from our community, so we put the survey back out there this year. We got quite a bit of feedback last year, and so we figured it was successful, and we want to continue to get that from our community. I should mention it does have community development. I apologize to Annette, to you and your department. It should say community and economic development. Looking forward, some uncertainties that we continue to have: federal government, state government, local government aid, inflationary impacts, the Economic Development Authority, tax increment financing, and I should add the county as well as the ambulance fund, just because that's with the services that we're providing. It's not cheap, but it's something that is a great service to our residents, community, and others. Again, just want to bring out in front of you the budget process and timeline. So as I mentioned, on April 25th at the spring cleanup event, we provided the budget engagement flyer. On May 11th today, we're doing our kickoff. June 15th will be the special meeting to discuss trends and set priorities for 2027. That is a new engagement opportunity for the 2027 process. July 8th is the budget engagement at Celebrate Summer. July 13th will be our EDA budget discussion. August 24th is the City Council workshop. September 14th is when Council will adopt the preliminary levy, and as a reminder, once that levy is set, it cannot increase, however, it can be decreased. So it'd be the highest amount that Council would consider at that point. September 18th will be another budget engagement at the Friday night fireworks. November 9th and 23rd will be budget presentations, and then on December 14th, we'll wrap it up with a public hearing for council to consider the 2027 budget and the 2027 to 2031 capital improvement plan. And with that, that's all I have for you tonight.
Mr. Sable?
Thank you, Mayor and council members. I want to thank Joe Rube for the work that goes into this. This is, I think last year there were 13 budget discussions at this table, and then the community outreach was there, and so I think he's done an incredible job of going out in advance, and so you'll still see the famous sort of budget game where you get 10 million mythical dollars to distribute to where you think it should go. But at Truth and Taxation hearing last year, we heard a significant amount of people saying, well, I didn't know that was here. I didn't know about that. And so even in this month's Living, there was a front page article about this meeting and the budget kickoff. And so our goal is that no one goes uninformed and has an opportunity to provide some input. And so it is the most expensive document and thing that we put together, right, is the statement of values of the council for the community. And so it really is important. And I have heard consistently that budget engagement is a priority, and you're going to see a lot of it and a lot of us this year talking about it. So thank you.
And Mr. Rube, we're looking forward to that game again that you made. Thank you for that. I know a lot of people appreciated that, and I appreciated your effort on that, so thanks. Any other questions, council? Well, that was our budget kickoff, the first one. We have one more item on our agenda. Mr. Sable, do you want to tee this up?
Yeah, thank you, Mayor and council members. So I wanted to provide a legislative update. As you know, the city of Maplewood put together a legislative program with a series of asks for what we would like the legislature to do. We are often at the whim of the legislature, so it's a waiting game. But they have 7 days left to conclude the business of the legislature. Now, this is the second year of the biennium, so they are not obligated to do anything statutorily, but they are taking a number of items under consideration. Probably most importantly, the city of Maplewood put forward a request for a local sales tax to fund the Maplewood Community Center, the East Metro Public Safety Training Facility, and a request to do the Afton Heights Park. We were able to secure hearings in both the Senate and the House for those bills. And as you know, it's a legislature, and so there is a Senate tax bill that does include 2 of the 3 projects. It includes the East Metro Public Safety Training Facility and the Maplewood Community Center. Those provisions are in a bill. However, by virtue of the legislature, a tax bill must originate in the House in order for it to be considered by the governor, and the House has yet to submit a tax bill. So we are in a precarious waiting game regarding the tax bill. Our legislative team from Lockridge, Grindle, and Nowen indicates that we will know hopefully by Thursday afternoon or as late as Friday morning whether or not there will be a tax bill. Right now, the leadership of both the House and the Senate and the governor's office are negotiating what that might look like. And so I wish I had better news. So it's best summarized this way. If there is a tax bill, it's likely that we're in it. And that's probably the best I can do as an offer. The other component is the other significant ask that we had put forward was a bonding request for the East Metro Public Safety Training Facility. We'd requested $4.8 million in bonding money. Again, a similar rule, all bonding bills must originate from the House. The House has not submitted a bill. And so they're holding their cards very close. We have heard indications that a Senate bill does include money for our project. And so very exciting. So I guess I will say the second part is because we had a hearing last year and we were part of the bonding tour this year, it's very likely that if there's a bonding bill, we will be in it. So, and again, we will know that provision, I think, largely on Thursday evening, Friday morning. And the other quirk in the legislature is they must conclude their business by midnight Sunday evening or Monday morning, however you want to do that. They're not allowed to pass any bills on Monday. So I would say Friday, Saturday, and Sunday are going to be very busy days for our lobbying team to advocate on behalf of the community. The other piece that's fairly significant was there's a lot of conversation about housing bills in the legislature. particularly around preempting local zoning authority and those, trying to spur on housing development. Those initiatives are largely dead at the legislature. They did not get hearings in the Senate, and so there's no going to be no preemption of local control for this legislative session, which I would forecast then that really means that we are likely to hear about it at the next legislative session. So a lot of moving parts, but I thought it was helpful to provide a little bit of an update. We continue to advocate. We continue to try to give support to, and I just want to share that our legislative delegation have been huge champions for the community, both in setting up for hearings, but also just providing updates. And so I think we're all in the same boat. It's a strange year for an election year. When the Speaker of the House is running for governor, it creates an extra dynamic of uncertainty. And so we are at the whim of the legislature, but we are as well positioned as we could be to be successful. And so with that, I'll stand for any questions.
Any questions for Mr. Sable? Should be an exciting week.
We are keeping our fingers crossed that both a tax bill and a bonding bill get passed and that we are in both of them.
Thank you very much. I don't see any lights on. So council members, we have concluded the business for this workshop. And with that, we are adjourned.